We just need one final speaker, but while we're waiting, I wanted just to mention some of the organizations that are here in the room. We have about 47, I think, we're at organizations supporting this event. And some of them that are here that you're welcome to grab after we finish the press conference for one-on-one interviews. You're more than welcome to. We have Seton Healthcare Family, doctors here from Doctors for America, CPPP, Texans Care for Children, Children's Defense Fund, Easter Seals Central Texas, National Alliance of Mental Illness, Coalition of Texans with Disabilities, Texas Impact, Consumers Union, Progress Texas, and TOP. Have I left anybody off? And Christus is here from San Antonio. Fantastic. Tiffany, are we ready to go? Or we'll get started? Okay. Announcing Sister JT from Seton Family Healthcare.
I want to echo Laura's good morning and welcome to you. This is a great day. As Laura said, my name's Sister JT Dyer, and I'm an advocacy and outreach consultant for the Seton Healthcare family. I specialize in healthcare issues that impact lower income individuals and families. Seton's mission is to care for and improve the health of those we serve, with a special concern for the poor and the vulnerable. Having access to health care coverage is one of the tools that can lead to improved health outcomes. And so that's why today Seton Healthcare Family is proud to be one of the more than 40 organizations that join in saying, Texas, we have a problem. We have a problem, a big problem. We know the importance of health care in the life of every person, every man, every woman, every child. Yet, because of the decisions our state made, it's estimated that over 1 million Texans are being told, no, there's no affordable way for you to get health care coverage today. When you get sick, you can continue to manage as you have been, delaying needed health care, being subject to preventable life-threatening diseases, and frankly, dying younger than your neighbors who earn just a bit more money than you and were able to get subsidized health insurance. All of us know people today that are finding they're left out of coverage. And many of those are the working poor. They cross our lives every day. It's the construction worker helping to rebuild the flood-ravaged homes. It's the person that takes care of your child in the nursery, and the health attendants caring for your aging parents and relatives so that you can go to work with a peaceful mind. Yes, and it's the restaurant worker who served you lunch yesterday, and the 19-year-old college student who can't get on his parents' health plan because those parents themselves did not have a way to affordable coverage. Worst of all, for me, do you realize that here in Texas, over 66,000 veterans and their spouses are being left without an affordable way to health insurance? These are the men and women who put their lives on the line for our safety. Seton stands with all those who are left out, and with the faith groups, community clinics, child advocates, and local government entities who are sending a letter to the Texas legislators that this problem needs to be fixed. It needs to be fixed as quickly as possible. We want our fellow Texans and our state legislators to hear stories of our Texas neighbors who have been left behind. Today, we are launching the Texas Left Me Out campaign. This campaign, created by members of the Cover Texas Now coalition, to make sure those families that have been affected by this coverage gap, that their voices are heard. We ask that anyone who has been left out without the opportunity for affordable health care coverage, as well as those who support closing this coverage gap, to go to our website, texasleftmeout.org, or in Spanish, texasmedejoatras.org, and tell your story, have your voice heard, and work together to make a change. I'd like now for you to hear some personal accounts, people who are working today and are experiencing, either because they're interviewing people or their own life experience, they're in this coverage gap. I want you to hear their stories, and so I'm going to pass it to Elizabeth from Insure Central Texas. Nice to see you.
I'm Elizabeth Colvin. I'm a certified application counselor, and I run a program for foundation communities called Insure Central Texas. We help families and individuals access the benefits that are available to them in the Affordable Care Act. Unfortunately, we have a really awkward situation in Texas. For people who are above this sort of arbitrary line, the 100% federal poverty level line, they can access the benefits of the Affordable Care Act and get subsidized health insurance. For people who fall below that line, they have no options. They cannot get help paying for insurance. So in Texas, you will have a single parent of 2 children who makes $17,000 a year, who has no options, and another single parent who makes $20,000 a year in a very similar situation, yet she happens to be above the line and is eligible to get insurance that costs $0 a month or $33. She has a choice of plans at very affordable rates so she can have health coverage, and yet the other mother is left with really no options. As a certified application counselor, we have to tell people every day that, I'm sorry, where your income falls, that you can't get help paying for insurance. And there's no worse feeling when you know that that person needs a surgery, has a medical condition that needs attention, and there are no options for that person. And we have to be the bearers of the news that society has left you out. And we see those people every single day at Insure Central Texas. Thank you.
Good morning. I'm Linda Berman. I'm 63 years old, and I've been uninsured in Texas since 2009. I earn my living presenting interactive educational programs for children in Texas and around the world. Known as the Texas Bubble Lady, I'm the original soap bubble educator and performer in Texas. Even though I work to stimulate the young minds of future Texans, present-day Texas has said it's not enough for me to get health care. I brought my science, math, and critical learning program to Texas after performing for many years in Southern California. I love my work. I love every smiling face who learns about the wonder of soap bubbles. I have lived with the challenges of type 2 diabetes for more than 20 years. When I moved to Texas, this pre-existing condition resulted in health care insurance being unaffordable. 2 years ago, a medical crisis resulted in an ambulance trip to a nearby hospital. My 4-day stay as an uninsured patient resulted in hospital and doctor bills that were more than $70,000. I was unable to pay the bills, and I had to file Chapter 7 bankruptcy. On October 1 of last year, I attempted, as many people did, to go online and create an account at the marketplace and buy health insurance. Unfortunately, like many, I couldn't get online that day, but I watched a local TV news that night, and they had representatives from the Texas Organizing Project with a phone bank answering questions about the Affordable Care Act and the marketplace. I picked up my phone, I called. I spoke with one of the top staff members who explained to me that they were holding a workshop on October 10th, and they would help me sign up for health care. They called a couple days before to remind me to attend, and I was there. Unfortunately, I learned at that meeting all about the Texas Organizing Project, which I joined, and I learned about the coverage gap that included me. I had hoped because of health reform that I would finally be able to afford coverage, but I quickly learned that our state had made a decision to keep low-income Texans from getting Medicaid coverage that they qualify for. I moved to Texas from California for a better quality of life, but I'm kind of trapped now. And there are many other hardworking Texans who have similar stories. Texas needs to make sure that all Texans can still live that American dream. If you work and contribute to society, you should not be penalized with unaffordable health care costs. You should not have to file bankruptcy for seeking medical care that you need to keep working. I ask those of you who fall into that gap like me to raise your voice and contact our representatives. Explain to them what your life is like living without affordable health care. And I ask everyone else in this room to please join Texas Left Me Out, join the campaign, go online, and let's all work together to make this change happen. Thank you.
Good morning. Hello, my name is Irma Aguilar, and I am a 28-year-old mother from San Antonio. I have 4 children. I work hard. I do the best with what I have, and I have been left in the coverage gap. I have been left behind. I am trying to do everything right to gain footing in life. I am assistant manager at Pizza Hut restaurant and have been for quite some time. Despite my effort to provide for myself and my 4 children, I do not make enough money to qualify for the affordable health care that I deserve. But my struggles do not end with my financial position. My health is a concern that I live with every day. Not having health care coverage is an unfair challenge that puts me in a position where sometimes I cannot even do my job. I have damage. I'm sorry. But my struggles do not end with my financial position. My health is covered that I live with every day. Not having health care coverage is an unfair challenge that puts me in a position where sometimes I cannot even do my job. I have damaged disc in my neck, which makes it hard to raise my arm. My job requires a lot of physical movement and heavy lifting, so not being able to raise my arm on the job becomes a burden on my performance in the workplace. In addition, I have high blood pressure that I obviously have been unable to afford treatment for. Already this makes me dizzy on a periodic basis, making me have to grab onto something in order to keep myself from falling. These are not idle situations to do my job to the best of my ability. Every night I lose sleep. Every morning I begin my day with stress. And every second I worry about the well-being of my family. With all these thoughts running through my head, I have developed a major case of anxiety that causes my heart to race wildly. I need to be able to keep working and providing for my little family, but every single day I worry about what would happen if I had to stop working because of my health condition. That's the problem. I need money to buy health insurance, and I need to keep working to have money. It's a problem that me and over 1 million Texans have at this very moment. I've always lived with the belief that if you work hard, good things will come. I work hard every day, as do the many Texans who need insurance. I want my children to live in a world where the hard-working people of the state get what they deserve. A chance to live healthy lives. Texas left me out, but I'm here today sharing my story so I can change that. Everyone in my situation should too.
Thank you very much, Elizabeth and Irma and Linda, for sharing your stories and helping more of our Texas citizens understand what this problem is really about and how it faces real people every day. There are 3 ways that people can join in the Texas Left Me Out movement. One would be to go to our website, which is texasleftmeout.org, or in Spanish, texasmedejoatrás.org. Also, we have a number they can call. Not everybody we know has access to the Internet, and so we have an 800 number, and after you listen to a pretty long message that talks a lot about the Internet and online, you get to the part that says if you want to become active but you're not an Internet user, just leave your name and number and a real person will call you back. And so that number, please take note, 866-697-3155. 866-697-3155. Now, if you're part of the younger generation, of which I am not, you can text. And in English, you text left out. Or in Spanish, cobertura. And you text that to 30644. And that will connect you to the campaign. Again, text in English left out, or in Spanish, cobertura, to 30644. Now, we are ready to take questions, and as Laura mentioned before, there are a number of organizations represented in the room that will be happy to field those questions. So if any in the media have questions, and Laura, are you going to come, or you want me to?
Sure. We have a number of folks, V. Moorhead at Texas Impact, Ann Dunkelberg from Center for Public Policy Priorities, Tiffany Hogue from TOP, and myself, as well as our partners here that we will pitch questions to, if you all have any. And also, I just wanted to make the note that immediately after this press conference, we're going to be delivering a letter to every legislator in the state capitol with support from 47 organizations that do work here in Texas, including providers, local government entities, even business chambers already, and public interest groups, telling them that this problem is urgent, that we need a solution to this, and asking them to help with the Texas Left Me Out campaign. Any questions? Yes?
Could someone talk a little bit more about specifics of what this coverage gap is, who falls in the gap, and how to get the income levels that it's affecting?
Tiffany?
Sure.
So in Texas, it's over 1 million Texans that have been left behind or left out. 48% of them are Hispanic. Another 33% are Anglo. Another quarter or so are African American. So it's a diverse group of people. Income level, if you are a single person, it's about $15,000, $15,500. You know, so that's the line. It's not a very high line. So you're talking about people, as Sister mentioned, a lot of people that work in the construction industry, a lot of people that work in food service, a lot of home health care workers, whole industries that are known or, you know, don't provide health insurance to their employees. A lot of them fall into the gap.
Can you explain a little bit more what that gap is based on? What are the guideposts on this?
Sure. So, and I don't remember who said this, but it's sort of an arbitrary line. It's based on the federal poverty line. So it's a combination of your household size and your income. And the Affordable Care Act, the exchanges, financial assistance starts at the 100% federal poverty line. So the gap is under 100% between what our current Medicaid program offers in Texas, which is very restrictive. So between what Medicaid offers in Texas now to that 100% line. I don't know if Ann wants to give a more precise answer.
Clarify that that's a state decision.
Right. It's a state decision that, the state decides what our Medicaid program looks like to begin with. So the fact that it's as restrictive as it is based on decisions made in this building. So that's also another reason why the number is so great in Texas, over 1 million people. And nationwide, it's about 20%, or it's over 20% of people that fall into the gap.
I would just add that adult coverage in Medicaid right now, to give you an example, for a family of 3, adult coverage in Texas right now, as an example, for a family of 3, you have to make less than $308 a month, and you have to be a parent. So it is a very small group of people, adults, that are able to get on health care coverage through Medicaid. And so by not having accepted federal funding to do Medicaid expansion or another solution that would provide health care coverage for folks under 100% of the federal poverty level, we've left that gap of folks without any coverage. And it's interesting because actually, if you're a citizen under 100% of the federal poverty line, you're in the coverage gap. But if you are a resident under 100% of the federal poverty line, because Medicaid doesn't allow residents to get on it, those folks are actually able to get financial assistance in the marketplace. So, what's that? A legal resident. So it really is penalizing citizens largely who work. They're making minimum wage. If you make minimum wage and work 40 hours a week all year round, you can very much end up falling in this coverage gap.
Laura, just say a word about childless adults. Do you want me to?
Yes.
Childless adults in Texas cannot get into Medicaid at all. It doesn't matter how poor they are. Now, if they'd be disabled, they could. But a regular childless adult in Texas is not eligible for Medicaid coverage. So they're part of the group that's in the gap. So you're talking about your young people, 27 or 28 years old, possibly college graduates who are trying to start a business. Low income when you start up a business. You know, there's so many people in this coverage gap. Thank you.
I'm Dr. Robert Ludicky, and I wanted to just make sure that we didn't leave here without me saying that it's not a matter of deciding whether the citizens of Texas want to come up with the money to pay for this health care. We've already paid the money. We've already paid the money to the federal government in terms of our federal income tax. So the decision we have to make is whether we're going to come up with some program that will allow us to bring this money back into the state and use this for our residents, or we're going to continue to pay for it twice by paying local taxes while our federal taxes that we've already paid have gone somewhere else. So this is not an economic kind of decision. According to Ray Perryman, who's an economist, the state of Texas can afford to do this. And in fact, he says the state of Texas can't afford not to do this. We can all lower our taxes in the state if we find a way to bring this federal money back in to the state, either through Medicaid expansion or another version of doing the same thing, or doing a similar thing.
Dr. Zedecki, how many billions of our tax dollars are we leaving in Washington and not bringing back to Texas to pay providers to do the work of caring for the sick and injured?
According to Ray Perryman, we're talking about $100 billion left in Washington over the next 10 years. And in return for that $100 billion, the state of Texas would need to come up with $10 billion to bring in that $100 billion. And I'm not a real big business kind of person, but it sounds like a pretty good deal to me, especially when we're paying extra to take care of the people that we're already taking care of. And this will create a whole lot of very good paying jobs. And in return, those people will pay the taxes. And that's how the state of Texas will actually make money on finding a way to bring this money, federal money, back into the state to care for patients.
Dr. Luedecke, if I may say, the Berman report also said that increased economic activity would more than repay the $10 billion out of the state budget. So it's actually a revenue positive to the state, in addition to all the benefits of the health care.
Exactly. What I saw was that Mr. Perryman says that for every $1 the state of Texas puts out, they will take back into the Texas state tax coffers $1.29. And again, I'm not a real big businessman, but when you get more money back than you put into it, it sounds like a fair deal to me.
Dr. Luedecke, isn't it also true that in addition to bringing those tax dollars back into Texas, that the Medicare rate structure has to be improved so that providers can afford to cover the costs of providing care? Isn't that the other big unfinished work?
It is certainly true that Medicaid rates at which physicians and hospitals are paid are among the lowest in the United States. And a lot of people aren't aware that those rates are set by the Texas legislature. They're set by each state. They're not legislated at the federal level. So the Texas legislature could actually do something about that if they wanted to. Right now, I get paid about 30 cents on the dollar for taking care of somebody who has Medicaid. And I'm very happy to take care of Medicaid patients. I can't take care of just Medicaid patients, or I take a 66% pay cut. So yes, that is a very big concern, but despite that concern, at the last meeting of the Texas Medical Association, a majority of Texas doctors voted to expand Medicaid in Texas now. With all its weaknesses and all its frailties, they know that the patients need the care, and we will take care of them if the state will let us.
Thank you so much. I think B from Texas Impact.
Yeah, I'd just like to add one more note to the fiscal part of the equation. In addition to the state effectively burning $100 billion worth of federal funds that represent Texas taxpayer dollars sent to D.C. over the next 10 years, we also, by not expanding Medicaid in the current biennium, chose not to take advantage of $1.2 billion in general revenue that could have been saved and used in other state programs, like school, for example, which we're also currently looking for extra money for. So by not doing the Medicaid expansion, it's not just that we're not getting the federal funds that we would have gotten, is that we're actually wasting state taxpayer dollars that could have been used in other programs, and that would have been happening in this current biennium, not over the next 10 years, but right now. So that would have been $1.2 billion in general revenue that we would have saved.
Well, B was too modest to do it, but I want to plug another resource along this line. I'm Ann Dunkelberg with Center for Public Policy Priorities, and I just wanted to mention that we've been fortunate in Texas that we had not only Dr. Perryman do research on this topic, but also former Deputy Controller Billy Hamilton did research on it. On Texas Impact's website, as well as on the website of the Texas Association of Community Health Centers, which is a big supporter of getting to a Texas solution, you will find what the data people call widgets, but you'll find a little graphic that shows you a ticker of how much money Texas is losing every second in this current biennium.
$113 a second.
$113 a second, and it will show you what we're up to starting on January 1st of 2014. So Texas Impact is one place you can look for it, and the Texas Association of Community Health Centers. Both of their websites feature that. Thanks.
I'm going to say one more thing. I'm not as modest as all that. But in addition to that information on our website, one of the other issues that Dr. Luedecke raised is that local taxpayers do also foot the bill when people don't get the health insurance that they need. And also on our website, which is texasimpact.org, you can find a table that for each county in the state and for each legislative district in the state shows how much those taxpayers in that county or district are paying to cover indigent care for people who would have been Medicaid eligible if the state had chosen to expand Medicaid, as well as the number of people in that county or legislative district who are being left out.
Are there any further questions from the group present? If not, we'll close the official press conference, but know that all these organizations or representatives can answer your individual questions if you want. Thank you very much for being here this morning, and remember, TexasLeftMeOut.org.
Well done.
Thank you.